All right, Dr. Collins, on behalf of the Advanced Orthogonal Institute, and let's talk about another reason to go AdvO. And here it is. Ready? Post X-ray analysis and interpretation. And I know what you're thinking. That sounds boring, but I'm going to tell you, it's been coming up in the interviews that I've been doing recently, particularly with Dr. Slininger. These post X-rays and the analysis is your freedom. This is your freedom. This allows you to be independently within your office, able to self-correct, give your patient the highest quality adjustment possible, correction after that first one, you have real feedback. And just generally across your practice, you are going to see if there are things that you are doing with your setup in terms of table placement that is less than perfect, and that's going to show up in that post X-ray. So I have my table here. I'm going to show you what I'm talking about specifically. Let me get into it. The nature of the advanced orthogonal procedure is that each one of the factors on your X-rays, okay, these are mine, for example. Each one of these line items that you'll see, right, ACD, that's the atlas tilt, the rotation of your C2, the lower angle, and the AFP, rotation of atlas, all of these ingredients directly correspond with influences on this table in terms of table placement, right? The mastoid setup, how secure that mastoid is in terms of the ACD, that atlas tilt, the plane of the atlas, how high or low is that head? The shoulder position with this table, how lovely is that, right? This is going to address that lower angle, right? Taking that shoulder girdle north or south, S or I, is going to influence how that lower angle is. The rotation of C2, right? I can take the shoulder girdle anterior or posterior, right? Which is going to take and rotate in either direction that shoulder girdle and take that C2 with it. What is so nice is when we're talking about post X-ray analysis and interpretation is with this procedure, I have my pre-X-rays and then I'll have my post X-rays. So when I have my patient set up here to get adjusted, determine they need to be corrected, they're out of alignment, I now can take and look at their pre and post X-rays that I have on file and go, okay, for this guy, Christopher Collins, he has this, slight peculiarity versus the standard influences, right? So I'm not just taking and measuring and adjusting somebody on this initial analysis. Now I have how this person responds specifically, how their biomechanics respond to the adjustment that is associated with their pre-X-rays, right? How does this particular person respond? And if there's something that I'm doing across my practice, right? Like if I'm too low on my head, P side, if I'm not influencing enough for the cervical spine, that's going to show up as a pattern across my post X-rays. So finally, I would say this is just another great reason that you should consider going AdvO. If you're a student and you're in school and you're trying to figure out what technique you want to do, I would point you to this kind of a benefit within a technique is the ability to not only perform a technique, but adapt it and improve personally in how you are functioning as a doctor over time. So with that, consider post X-ray analysis and interpretation as a reason that you should go AdvO. Take it easy. God bless.